Testing.
Oh.
Requesting the faculty and dean, please, and the guest, Stephanie, please have fall in line for our procession. Thank you.
Testing.
Now for you?
Yeah.
Okay.
If you don't say, you just turn it off. I
Will
will
it
turn
work?
it
As
off.
long as it works. Graduates, please be seated. Good afternoon, members of the faculty, distinguished guests, families, and graduates of the LVN Fall Class of 2022. My name is Jennifer Hong, and I will be your MC tonight. I am a graduate of this same LVN program and have returned to City College to serve as a faculty member 8 years ago. This is where I started my nursing path and has provided me a strong foundation that this class will also utilize. It has been my pleasure to have taught this graduating class. 18 months ago, this class started with 22 students. Every semester, the number of passing students dwindled and thus created a smaller, closer group. 18 students remain. This program has served a difficult journey for them, filled with many challenges and uncertainties. These students entered nursing school in the midst of the COVID-19 pandemic. They have had no person face-to-face lectures. They learned from the instructors online via the computer on Zoom. They did not have the same advantages pre-pandemic of having fellow students sitting next to them to ask questions or gain support. They had to learn and study more on their own at home away from peers. Clinical placements were constantly evolving, as when the rates of COVID cases increased or surged, hospitals would not allow student nurses at the facilities for months. Students and faculty had to be flexible and perform Zoom case simulations that would emulate similar nursing knowledge of skills and health conditions at hospitals. But nothing beats hands-on learning. Countless sleepless nights fueled by coffee and energy drinks were spent writing care plans, major care plans, crisis care plans, community health presentations, and of course, last-minute cramming for exams. All their hard work and dedication has brought them to this day. We are all here gathered today to recognize that. Please join with me to celebrate this great achievement. Now, I would like to take this time to acknowledge Dr. Dean Edith Kapner, Dean of School of Health Education, Physical Education, and Social Services, and John Adams campus. Dr. Jean Lansing, Department Chair of the Licensed Vocational Nursing Program and Certified Nursing Assistant Programs. And now I would like to introduce Dr. Edith Kapner to speak a few words. Please welcome Dean Edie.
First of all, I want to thank you all for coming here. This is a monumental point in these students' journey, because at this point, they're going to go out, and after they study and pass the NCLEX, they're going to begin to put all this knowledge to work, and they will be in a journey of helping people. But they weren't the only ones on this journey of learning, and all the late nights and all the caffeine that had to go into studying last minute. All of you were too. So this is your graduation also. And the pride that you're feeling, the emotion that you're feeling right now, that's because they made a goal and you helped them get there. So realize that not only are your students sitting here, but you helped them get here. You were there supporting them. You were there helping them with chores when they were studying too hard to finish them. You were there to be a shoulder when things got tough, to listen to them when they were thinking that maybe it was a little too hard. And giving them the encouragement to continue on. And look where they are now. They have made it. And they made it through a pandemic. Realize that the experience that they had going to college here is unlike the experience that most of us had going to college. They weren't in the in-person classes all the time. They were on Zoom. They were finishing up. They didn't have the camaraderie, the study groups, and everything else that usually form during this time, although I imagine they formed them anyway, and I'm glad about that. And you know, they learned things like what a green screen was and had me ask them multiple times to show me their green screens as I was making sure that we all stayed safe. And I want to say that this accomplishment you should hold dear. Remember this, because this is going to be the first of many steps in your career. You're just beginning. You have chosen a field for helping others, and others will look to you in times of need, and you will be there, just like these people have been there for you. So please go forward. Remember, CCSF is always here for you, and we're very proud of you. Thank you.
The class has chosen Ms. Stephanie Darden as their faculty guest speaker. Stephanie Darden was their LVN Advanced Medical Surgical Lecturer. She is a registered nurse of over 6 years and obtained her Bachelor's of Nursing from the University of California, Los Angeles. She is a pediatric, hematological, oncology, and bone marrow transplant nurse. She is a nurse entrepreneur and owns a healthcare training and a consulting company and is a native San Franciscan. Please welcome Ms. Stephanie Darden.
Thank you, Jennifer, for that great introduction. Good afternoon, everyone. I want to start off saying thank you to Dr. Lansing, Dean Eady, fellow faculty colleagues, and John Adams administration for allowing me to speak here today. I also want to give a big thank you to the graduating LVN class who asked me to speak at their graduation today. It is truly an honor to be here to address your graduating class. As a San Francisco native, I enjoyed teaching these graduating nursing students because it felt like I was training members of our San Francisco community to take care of our San Francisco residents. Before I started teaching here at City College, I've been teaching nursing students in the clinical setting for the past 6 years in both Los Angeles and San Francisco. I enjoy teaching nursing students because I love being able to share my passion in my career with others. My favorite question I always ask my nursing students is, why did you choose nursing? I love finding out about people's why because a person's why says a lot about them. The answers I hear on why students pursue the nursing career is, I want to take care of people, or I want to work in the emergency department or on a tele unit, or a family member was a nurse, or that they volunteered at a hospital. These were common responses I heard and all great reasons to be a nurse. But when I asked these graduating nursing students, why did you choose nursing? Their answers were not typical responses that I hear when I ask this question. Several of these students said they chose to become a nurse because they want to be able to take care of their parents when they become elderly. Other students said they became a nurse because their family immigrated from another country and want to help them access healthcare. Several of you are the first in your family to pursue higher education, to get a degree, and to become nurses. Some of you want to pursue public health nursing. One student has a son who frequently was sick, and that made her pursue nursing as well. One student pursued nursing because she wants to make a change in women's health among Latino women in her community. All of your whys are very important to me. And even though you all told me your why over a year ago, I couldn't forget it. I was so humbled to be your nursing instructor because I was not just teaching nursing students, I was teaching future leaders. Their reasons for becoming nurses were not about them, but all about serving their family and the communities they come from. Because family members were a big inspiration to these students becoming nurses, I would be remiss if I did not acknowledge all of the family members, their friends, and the supporters of these graduating nursing students. These students invited you here today, either in this room or virtually, because you were there for them in times that they really needed you the most. You were their biggest supporters to finish and succeeding in this difficult nursing program in the midst of the uncertainty of this pandemic. I want to thank you for being their support system, the sacrifices you made as well, so that these students could finish and graduate from this nursing program does not go unnoticed either. And I want to acknowledge your important role in their success because it takes a village. One of my favorite preclinical discussions that I had with a small group of students via Zoom was teaching them about health literacy. As nurses, our patients' health literacy is important because it is the degree to how our patients not only understand basic health information, but how to take care of themselves. This was my favorite discussion because earlier that day, I taught a lecture on diabetes. So I had this particular small group practice in Zoom what it was like to be a patient educator, a really important role that as nurses, we have responsibility. I gave them this scenario that they were all public health nurses assigned to a mission district health clinic. The patients attending their pre-diabetic or were pre-diabetic and had little to no understanding of diabetes. So I divided them into groups of two, and they had to develop an interactive class to educate patients on how to manage their diabetes. And in only 15 minutes of preparations, these students gave the best presentations I've ever seen. I was in awe. I had goosebumps. When I saw them teach what's diabetes, the risk factors, insulin, important foods, lab values. The reason these students did such a great job on teaching was because they understood and could empathize with the patient population they were teaching. I was so humbled to be your instructor because you're exactly the type of nurses we need in this world. As someone who works in healthcare, my why has brought me to so many different avenues in nursing. I became a nurse because when I was in high school, I volunteered in health fairs in my San Francisco community. I shadowed doctors and nurses who performed health screenings in my local community center. What alarmed me was that so many people in my neighborhood lacked access to healthcare. They haven't seen a primary care doctor for years. They didn't know how to schedule an appointment. And many of them had untreated, undiagnosed hypertension and diabetes. I became a nurse because I wanted to be a bridge for people who looked like me to have access to healthcare. I hope your passion, your why, gets reinvigorated when you start working as a nurse and you feel you're exactly where you're called to be in. Being an instructor to these nursing students helped me to see my second why. Being your nursing instructor allowed me to increase representation and create access for more people from diverse backgrounds to enter nursing careers. Nursing offers so much to those that seek opportunities. Continue to seek opportunities, continue to walk on this uncertain path, but always remember your why that got you through this program. To the graduating nursing students, I want to honor why you all became nurses. Choosing to become a nurse is not an overnight decision, and the journey to become a nurse, as you all know by now, is anything but easy. You should feel accomplished. Amongst a time of so much uncertainty, in a global pandemic and civil unrest. Being in nursing school is stressful enough, but you all managed to persevere being nursing students in a time in healthcare where everything is unknown. Be proud of this accomplishment and remember this accomplishment moving forward. Amongst adversity and uncontrollable situations, you were able to show up and complete your calling as a nurse. That is your story, and no one can take that away from you. Your selflessness, your dedication, your ability to perform under strenuous circumstances are all commendable. Nursing is forever changing, and never have I seen this be more true now than a time before. With COVID, we unmasked the social injustices in healthcare that were always there, but now are seen. The awareness you have now due to the global pandemic is an awareness in prior years had to be taught. You firsthand got to see this. Be prepared to use your same strengths and perseverance that got you through nursing school to not only help our healthcare crisis, but to be the solution. While there are still many uncertainties in healthcare and in nursing, hold strong to what got you here today. Because as a nurse, even though how rewarding a career it is and how many memorable stories of patients you will have, there are going to be tough times. I guarantee you the road ahead is still uncertain, but your perseverance, your focus, your why will always get you through. I want to leave you with one last encouraging word. Your lived experiences and your personal stories are a gift to nursing because you have the ability to serve people that only you can reach. So with that, congratulations. Everyone here is so proud of you. It's been an honor being a part of your nursing journey, and I'm so excited to see how your story unfolds. Thank you.
Thank you, Stephanie. The class has nominated Ms. Daisy Lopez as their student speaker. Please welcome Ms. Lopez.
Good afternoon, CCSF faculty, friends and family of the LPN graduates class of 2022. My name is Daisy Lopez, and it is a great honor to be standing here with you today. Today, May 20th of 2022, is a day that will forever mark our new chapters in our nursing careers. First, let me tell you a little bit about myself and the life that I have lived to get to where I am now. When I was a little girl, my life changed forever. I was only 2 years old when I had an accident that left me in the hospital for 7 months. It was during this time that I came across the best nurse that I ever met. Throughout those 7 months, she was the most loving, caring, compassionate individual that there could have been. She provided such an excellent care for me that my mom was able to work without worrying about being unattended. Through the many stories my mother told me about this nurse has inspired me to become the nurse myself. I want to give others the same level of care that I was given during a period in my life that I most needed. I learned at a young age that life was not going to be easy. I was the youngest of 4 to a single mother who tried her best to give my siblings and I the best life she could. It was due to this effort that I was left with my grandparents at the age of 4 so that she could come here to the United States. So for a better opportunities than the ones that we had back in our home country. It wouldn't be till the age of 15 that I would see my mom again when I arrived in California. I used this opportunity that was given to me by my mother's strong effort to try to build myself a better life. Looking at where I am now, I can see that those efforts did not go to waste. I am now a mother of 2 which puts me up to a new challenge of having to go to school and work at the same time to provide for them. I am lucky enough to also have the support of my wonderful husband, Freddie, who was the first person who believed that I could go on this journey towards success. I would also like to give credits to my children for being understanding. Being a full-time student, a mother, and a wife is not an easy task. I had to focus on my studies, and my children were able to understand that I couldn't spend as much time with them as I could. These last few years did not come without some challenges of their own. Throughout a global pandemic, my classmates and I had to overcome many obstacles. We navigated through a new technology such as Zoom and simulations. We learned the differences between synchronous and asynchronous classes. Through the many hours spent virtually, we bonded as a group and learned a lot through group discussions. We have many skills days here at John Adams, practicing and demonstrating on the stimulation mannequins. I remember the time we were doing skills on maternity and had to swaddle the babies. I was shocked on how hard it was for me, knowing that I'm a mother and had done this all the time when my kids were babies. Clinicals, hospitals and clinics were limited and offered to a much lesser extent than usual. We all have experienced it at different settings such as San Francisco Rehab, Victorian Post-Acute, Canfield, the VA, Zuckerberg San Francisco General, Seton Medical Center, Potrero Health Center, and Student Health Center. We were exposed to new and diverse cultures, and we were able to interact and care for our patients. These experiences were simply wonderful. The time that I was able to spend with my classmates, having new experiences and forging new friendships is something that I will never forget. All my experiences throughout my life have come to shape who I am today. Much like every experience that each person in this room has come to shape who they are. And as we begin our careers as nurses, we take all our experiences and knowledge with us. Lastly, I would also like to thank the amazing instructors that I have met through my time here at CCSF. Thank you to all my fellow graduates for the amazing experiences that we have shared throughout the program. I'll keep those memories in my heart. Now, let's learn what we can from each new experiences and be the best nurses that we can be. Thank you to the LVN class of 2022.
Thank you, Daisy. The students have prepared a slideshow presentation documenting their nursing journey. May I now introduce Dr. Jean Lansing, Department Chair of the Licensed Vocational Nursing Program and Certified Nursing Assistant Program, to say a few words.
Good afternoon, everyone. On behalf of all the faculty and staff of the LVN department, we would like to say congratulations. We are very proud of you, Spring 2022 class. I am truly impressed by your class, and I mean it. In spite of the many challenges brought by the pandemic, from work and family, you still made it. This class is exceptionally good, actually. Do you know why? I never heard any issues at all from my third level faculty this semester. They're all sitting on the other side. Or maybe I have forgotten it. But if I do, that means there was nothing major, right? So please give a hand to honor and thanks our dear third semester faculty, Annette Peg, Susan Badawin, and of course, Natalia Villikina. Also, let us not forget that every knowledge starts from basic. Without the fundamentals, you cannot advance your skills. So please give a hand to our first level professors, Mary Brown and Minda Dudley. Of course, do not forget to thank your 2 and 42 instructors, our dear Jennifer Hong and Stephanie Darden. We also acknowledge the huge contributions of our part-time clinical instructors, whom without them, you will not be able to complete your clinical requirements from N41, N42 to N43 level. So one big applause for all of the faculty. Special thanks to our Dean, Dr. Edie Creeper, and staff, Eric, Faustino, Sean, and our lab aide, Amelia, out there, for supporting our students and putting all this audiovisual together to make this graduation even more special and meaningful. So to the parents, spouses, families, relatives and friends of our graduates present here, and those relatives and significant others watching via YouTube right now. You may be far out there, yet you are so close to the hearts of our beloved graduates here. Thank you all. Without your love, patience, encouragement, and support, they will not be here graduating right now. So let's give them all a round of applause. And of course, the last but not the least, to you, our graduates of Spring 2022. We are very grateful to have such a wonderful group like yours. I realized I did not even have to take any Tylenol at this semester. You are very flexible, adaptable, and work so hard. You studied patiently day and night. And have given the best you can to survive the challenges of pandemic and successfully blended work, family, and school schedules. I am very proud of you. So let me close by saying, it doesn't really matter how many years we live. What truly matters is how we live. At the end of the day, ask yourself, how did I spend my day? Did I help my client to feel better? Or did I stress them even more? Did I offer a hand to my colleagues when they need me? Or did I took my break when I was needed the most? Everyone makes a mistake, but what more important is what did you do to correct them after? In the morning when you wake up, before you go to work, talk to yourself again to remind yourself that you be kind, that you be honest, that you seek for the truth and stand for what is right, that you seek wisdom to visualize and implement your vision and mission, that when you do your job, you do it right. And most importantly, that every day as you work, you are making positive impact, not only for yourselves, but in the lives of the other people. So, class of spring 2022, let me tell you, the world is waiting for you to make a difference. You already have it within you. You got the knowledge, the skills, and the wisdom you need. So go and make the positive changes that you want to see in the world. God bless you and congratulations again.
And now the students will go to the stage to get their diplomas. First row, please stand. Miss Daisy Lopez. Miss Searing Key. Annalyn Haley. Teria Mohammed. Genevieve Toom. An Tran. For the second row, please rise. Anjalin Sanka. Eleanor Fabro. Jasmine Santoyo. Sylvia Olan. Monalyn Ferrer. Fazia Kifush. For the third row, please rise. Henry Bustamante. Sonam Dorji. Jesus Justice. Jemima Labarento. Cecilia Johnson.
I'm going to do the spiel. So that you
Dr. Langsing will be presenting the awards now.
Congratulations again. All of you have shown genuine interest and passion to serve our clients in the clinical, but 3 have shown exceptional and outstanding performance in providing the care for the clients that even the clinical staff and managers have undeniably noticed and gave them positive compliments. These 3 students will receive Clinical Excellence Award. As I call your name, please come up to the stage. Ready? The first one who will receive the Clinical Excellence is Sylvia Olin. So that I can go to the next one. Yeah, that's right. All right, that one. Our second awardee is Serene Key. And the last who will receive the Clinical Excellence Award is Antran. All of you have shown tremendous perseverance in studying day and night. All of you have passed your theoretical requirements and have successfully completed the program. However, one student has shown academic excellence by obtaining the highest GPA in the N43 level. The award for achieving the academic excellence will go to Jesus Justice. All of you have done a great job, so let's give a hand to all of the graduates. You know that completing the LVM program is just a beginning. You have more studying to do to pass the NCLEX PN, especially with the new generation NCLEX PN exam. So just do the best that you can, and you should be able to make it. Congratulations, everybody.
The moment you've been waiting for. Graduates, please stand. Face your family and friends. I now present to you the graduating LVN class of 2022. You may now turn your tassels to the left. Well done. Congratulations. It's time to celebrate.